Hi everyone, thanks for taking the time today to learn about ReadyRESCUE. My name is Dr. Matt Glassman. I'm a board certified veterinary surgeon at Friendship Hospital for Animals in Washington, D.C. And I'm one of the co-creators of ReadyRESCUE, which is a next generation activated charcoal product designed for veterinary and home use. ReadyRESCUE is the next generation of pet poisoning prevention. It's patent pending, and there is no other charcoal on the market that can provide the efficacy in a clean, more compact delivery system. It's the charcoal that everyone will be using in the future, and it offers a better way to treat animals in hospital as well as at home. Today we're going to walk through a few things. First, we'll talk about the problem of pet poisoning emergencies. Then we'll discuss how vets typically treat poisoning cases. And after that, we'll look at the limitations of traditional charcoal products like Toxaban. Then I'll show you what makes ReadyRESCUE different, including the research behind it. And finally, we'll talk about the expanded ways that hospitals can use it in its new form and why this matters to veterinarians. Pet poisoning is extremely common. Poison control centers receive 300 to 500,000 calls every year. And that number dramatically underestimates the true number of poisoning events because many owners never call poison control. Every pet owner knows the feeling of being in one room and hearing your pet getting into something in the other room. We subconsciously listen to these sounds because we know that pets are curious and gluttonous and love to get into things they shouldn't. These episodes happen on a weekly, if not daily basis for many pet owners. Pets ingest things like human medication, chocolate, THC products, rodenticides, plants. Every veterinary emergency hospital deals with intoxication cases on a regular basis. So activated charcoal is already a very familiar product to all of us. The most important factor in poisoning treatment is time. Most toxins are absorbed within the first hour of ingestion. The longer we wait to initiate treatment geared toward preventing the absorption of poisons, the less effective treatment becomes. The problem is that there are always delays. Owners have to identify the toxicity, determine the amount and severity of poisoning, which often involves contacting the emergency hospital or poison control, driving to the hospital, checking in, triage, getting treatment. These delays can often add 30 to 60 minutes on top of drive times to treatment initiation. There are a few antidotes for various pet poisonings, and the mainstay of treatment in veterinary medicine is GI decontamination. GI decontamination means removing the poison from the GI tract or sequestering it within the GI tract to prevent the absorption of the poison into the bloodstream. Options that we have are vomiting and adsorption of the toxin to activated charcoal. Vomiting has commonly been the first line treatment. However, it's not as good as we used to think. The utility of vomiting after 1 hour is questionable given the rapid absorption of toxins as well as the movement of the toxin from the stomach into the intestine. And it's recently been shown in the paper on the bottom right to be less effective than we previously believed. A recent paper showed that vomiting brought up a toxin about 65% of the time, but when it did, it brought up 45 to 50% of the toxin only. That is not great, and that's with apomorphine as well as hydrogen peroxide. The unreliability of vomiting for GI decontamination has been echoed in the human literature as well. Additionally, vomiting that's initiated at home, usually by hydrogen peroxide, works by burning the GI tract, which can result in secondary long-term problems such as esophageal strictures. Due to this, hydrogen peroxide administration in cats is completely not recommended. So because of these inefficiencies and constraints, the gold standard treatment in human and veterinary medicine is activated charcoal, which adsorbs toxins in the GI tract. Activated charcoal is widely considered the most universally effective GI contamination agent in veterinary medicine. It acts as a sponge for toxins, binding the poison and effectively holding it in the GI tract so it can be defecated out. This renders the poison harmless and allows the toxin to be eliminated in the feces and not absorbed by the patient. Given that there are few antidotes to poisons, when GI decontamination fails or is too late, the consequences can be severe. We're left with having to deal with the consequences of the poison, be it organ failure, or need to look at hemodialysis to pull the toxins out of the bloodstream. Hemodialysis can be useful to pull the toxins out of the bloodstream or eliminate toxins that bind or eliminate toxins that build up in the bloodstream from various organ failure, like kidney and liver failure. The problem is that dialysis is extremely expensive. It's also only available in about 34 locations in the entire United States. And for this reason, it's inaccessible to most pet owners. And it's for this reason that the best treatment for these poison patients is always early GI decontamination to avoid these life-threatening complications. Traditional charcoal products have a lot of problems. Anyone that's ever used them knows this. They're messy, extremely messy. They're high volume. They're difficult to administer to awake patients. They contain sorbitol cathartics, which can cause electrolyte disturbances with repeated dosing. They can cause GI impaction, the risk of aspiration pneumonia with them, and the consequence of aspirating charcoal is very high. And they have a short shelf life, often under 2 years. And right now, as many of you know, they're constantly on back order. This is where ReadyRESCUE comes in. ReadyRESCUE is not just another type of activated charcoal. It's activated carbon. Think of it as a pure, dense, lab-grown activated charcoal. There is nothing on the market that is as clean, dense, or effective as activated carbon. ReadyRESCUE's activated carbon sphere formulation is presented as sand, which does not dissolve and stays in the bead form all the way through the GI tract, as you can see by the little poop nugget on the top right. It provides the same toxin absorption as traditional charcoal by gram, but with dramatically improved usability. It's clean, 1/7 the volume of Toxaban, contains no sorbitol, and therefore has zero risk for electrolyte disturbances, does not dissolve in the GI tract, so impaction is not a concern, and has a 5-year shelf life. And it's currently in stock in multiple distributors, including Patterson, Covetrus, MWI, and VetCove. Additionally, it costs the same. One of the first questions veterinarians ask is, does it actually work the same as charcoal? That answer is yes. Research performed at the University of Georgia compared ReadyRESCUE with traditional charcoal products like Toxaban and pure activated charcoal. They tested adsorption against common veterinary toxins, including acetaminophen, naproxen, chocolate, caffeine, ivermectin, THC, theobromine, and mycotoxins. The result was equivalent toxin adsorption gram for gram. These findings show not only parity with the tested compounds, but also that ReadyRESCUE most likely binds the same for all compounds that bind to charcoal. We performed a prospective crossover study in dogs comparing ReadyRESCUE and Toxaban with technicians at my hospital that showed that they could give twice the dose of ReadyRESCUE in less than half the time of Toxaban. The important thing to remember is that we were giving a double dose of ReadyRESCUE versus a single dose of Toxaban and still had these key findings. Administration time and cleanup time was significantly lower for ReadyRESCUE over Toxaban, 7.2 minutes versus 19.3 minutes. Reported ease of administration on a visual analog scale was a median of 100 for ReadyRESCUE and 71 for Toxaban, showing that the perception was that ReadyRESCUE was much easier to give. The amount consumed was much higher with ReadyRESCUE via visual analog scale, with ReadyRESCUE having a score of 99 on a visual analog scale, with Toxaban receiving an 87. In terms of perceived acceptance by the patient, 7 out of 7 animals willingly accepted ReadyRESCUE, while only 3 out of 7 were graded as willingly accepting Toxaban. In other words, higher charcoal dose, which means twice the sponge to absorb poisons, delivered faster with dramatically less mess. For technicians in busy ER hospitals, that matters a lot, saving them time and the hospital money and allowing them to move on to take care of other patients. So if we summarize this comparison, ReadyRESCUE is clean, extremely low volume, contains no cathartics, is safe even at higher doses, easy to administer, and has a long shelf life, whereas traditional charcoal products are messy, high volume, contain sorbitol, difficult to give, and frequently not available. This is why hospitals are switching. This is a visual representation of the volume disparity between ReadyRESCUE and Toxaban. This is 48 grams of ReadyRESCUE on the left and 48 grams of Toxaban. Dramatically less volume that you're having to mix with food and administer to the patient. Dosing is also very straightforward with ReadyRESCUE. Each vial treats about 30 pounds of animal at a 2.2 gram per kg dose, which is right in the middle of that 1 to 4 gram per kg recommended dose. It can be mixed with canned food or dry food and water, syringe fed, or administered via nasogastric tube. But because it's clean and compact, it's much easier for technicians to handle. It has no taste whatsoever and really takes on the taste of whatever you decide to mix it with. As you can see, dogs tend to eat it readily. One of the most interesting things about ReadyRESCUE is that it actually creates additional use scenarios for hospitals. Obviously, first, we can use it in hospital for emergency use, as we've traditionally used other charcoals. Second, we can continue treatment at home rather than keep these animals in hospital and have to force feed them for the next day or two. Many toxins like THC, bromethylene, NSAIDs, chocolate undergo enterohepatic recirculation and therefore require repeated charcoal dosing. ReadyRESCUE can easily be sent home with owners for repeated administration rather than having to keep these animals in hospital. And third, it can be used for home emergency intervention in cases where patients are repeat offenders or where clients may have long drive times to get to hospital after hours, effectively eliminating that 45 to 90 minute delay in treatment that we see with most intoxications. Early treatment means better outcomes for veterinarians when those pets do get to the hospital for continued treatment and monitoring. This delay in treatment is crucial for a lot of pet owners, as many people live a good distance from veterinary care. This map shows increasing drive times to emergency hospitals, with the white having the highest access, with under 15 to 20 minutes, and the dark red having drive times of over 75 to 120 minutes. In many parts of the United States, pet owners may be 45 minutes. In many parts of the United States, pet owners may be 45 minutes to 2 hours away from an emergency hospital. And as we saw during that time, toxin absorption is already happening. So products that allow earlier detoxification can significantly improve outcomes, making veterinarians look better when it comes to better outcomes for patients. From a hospital perspective, ReadyRESCUE provides several benefits. It improves patient care both before hospital arrival, at the hospital, and after the hospital. It increases treatment speed, and it improves technician efficiency. It reduces mess, frustration, administration time, and it also has a much longer shelf life, which reduces product waste. And it creates a new treatment opportunity because hospitals can send vials home with patients. For all of these reasons, ReadyRESCUE represents the next standard of care in veterinary GI detoxification. It maintains the same charcoal efficacy but dramatically improves how the dose is delivered. Veterinarians and hospital administrators are constantly looking for new approaches that will lower costs to owners, improve patient outcomes, and improve employee work life and efficiency. ReadyRESCUE accomplishes these 3 tasks. Pet poisonings are extremely common. Activated charcoal is already the gold standard treatment. ReadyRESCUE simply provides a better way to deliver that treatment. If you have any questions, please don't hesitate to reach out. Thank you.